CDC says traumatic brain injuries are the leading cause of disability and death in kids ages 0 to 4.
Eye-opening statistics like that are why every March is Brain Injury Awareness Month. It's a time to talk about these types of injuries and also to show that many and how many can actually be prevented. So joining us now to talk more about this is Dr. Meysam Kebriaei, Medical Director of the Neurosurgery Program at Children's Minnesota. Thank you so much for joining us, Doctor.
Good morning.
Okay, so let's start with this. A lot of people, when they hear the term traumatic brain injury, they think of some type of catastrophic incident, right? But we know that that's not always the case, right?
Exactly, not necessarily. As a matter of fact, concussions, like we had talked about, are the most common cause of traumatic brain injury. And so concussions, as we know, can happen from sports, accidents, or falls. And with concussions, what happens is the brain, you can get a blow to the head or the body, and that causes disruption to the brain. And it may or may not lead to loss of consciousness. So even if your athlete doesn't pass out, that doesn't mean that they didn't have a concussion. And symptoms of a concussion can happen right after the injury or even days or hours or days afterwards. And symptoms like headaches, dizziness, balance issues, and we all know our kids well. So if your kid takes a blow to the head or body and they're just not acting themselves, think of concussion and seek out a professional opinion.
The statistic about traumatic brain injuries in that 0 to 4 though age group, it's always scary to me. That age group always has been scary to me because they toddle around, they bang their head on. We removed our table out of our living room at one point because they just kept banging their head, and I wonder. When you have those kinds of injuries for those little ones, can something little trigger that, or is it something where they're falling down the stairs? What's going on in that smaller age group?
Well, it certainly could trigger that. I mean, little kids they're designed to take hits, especially as they're learning to walk and those kind of things. But really, if they have a injury or fall and they're not acting themselves, that's when they start to worry. So if they're having balance issues, if they're walking and now they're having a hard time walking, if they're having sensitivity to light or sound, if they're vomiting and they're doing okay and they were not sick before the injury, those are warning signs for concussion and where you should seek out a medical professional.
Walk us through, I was going to say, paint a picture for us. Show us what happens if a person has a concussion. What happens to them, if you can really kind of demonstrate for us?
Absolutely. So what happens is you can think of the skull as a bowl. And this bowl, the brain sits in here, and unfortunately the brain doesn't have a seatbelt. And so the brain is sitting in water inside this bowl here. So when there's an injury to the head, the skull stops, but the brain doesn't. And the brain rubs and hits smashes against the parts of the skull, and that's where you get those injuries.
Okay.
Yeah. And go for it.
Yeah, we were talking about, I always heard that if you have a head injury, you're not supposed to fall asleep or lay down. Is that still the case, or?
Depends on what the symptoms are. If you're having symptoms that are worrisome for concussion or for traumatic brain injury, absolutely, that's very true. You should fall asleep. So sleepiness, increased sleepiness, or lack of difficulty falling asleep are signs of traumatic brain injury themselves. So it's more of a constellation of signs. So if it's 2 p.m. and you're normally wide awake, but you just had a head injury and you want to go to sleep and you're having a hard time staying awake, that's the worrisome sign.
Okay.
I have a hockey player, so concussions are always on my mind here. What happens though when you get to the point where you're at multiple concussions? Because we've seen that happen with our student athletes.
Absolutely. Multiple concussions are really severe because 1 + 1 does not equal 2 when it comes to brain injury. So you really want to be careful. Hockey's close and dear to my heart too. I have hockey players at home too. So really, for the folks at home and for the coaches, I would say if there's any doubt, then sit the kids out until they're cleared by a medical professional.
Yeah, and they've been doing that so much better than when we were growing up, and even from 10 years ago.
Absolutely. So, Dr. Kebriaei, thanks for joining us this morning. We appreciate it.
Thanks for having me.